Hi, this is Adam Mainville, and today I'm going to talk to you about my objective for this lesson. My group has chosen to talk about cystic fibrosis, and so I'm going to discuss one of the objectives that I have for this lesson. The objective is to correlate the pathophysiologic process of cystic fibrosis with the body systems and the disruption that it causes, and that can be found on the physical assessment. So for background information, what I'd like you to know is that cystic fibrosis is a genetic disorder that affects the CFTR gene, was discovered in 1989. As a result of this defective gene that the patient inherits from their parents, the body has an inability to move chloride around properly in the cells, and as a result of this abnormal chloride movement, water tends to stay in the cell, and the mucus around the cells that surround the cells is very thick and sticky, and it can cause a number of problems. One of the first problems that it can cause is that it affects the respiratory system in a very severe way. As a result of this mucus, the cilia in the respiratory tract are plugged up and covered, and this thickened mucus layer that tends to accumulate in the alveoli of the lungs and in the bronchia is a great medium for growing bacteria. As a result, patients with cystic fibrosis tend to suffer very severe respiratory infections that can be treated only with initially with IV antibiotics, and if the IV antibiotics don't work and the patient's immune or respiratory system is compromised, then they can have major problems with infections, and so they may often require lung transplants. The second body system that it really affects is the digestive system, and with the digestive system, the major issue is that, again, because of this thickened mucus that's caused by the defective gene, the ability of the pancreas to secrete enzymes that the body needs and absorb nutrients is not available because the ducts of the pancreas are plugged as a result of the thickened mucus. When these enzymes are not secreted by the pancreas, the patient has problems breaking down fats and proteins and minerals and vitamins into levels that are needed. So what tends to happen for these patients, the treatment that can happen for these patients, is that they require enzymes, pancreatic enzymes that they take orally that help digest the food and break the food down and help the body absorb it. The mucus also affects the digestive tract in that it plugs it up, tends to cover and fill the microvilli that line the small intestine with mucus as well, because the goblet cells are secreting excessive amounts of mucus. As a result of this mucus, again, the surface area that's required for absorption of nutrients is decreased, and as a result of the decreased nutrients, patients tend to lose weight. The third area that it tends to affect is fertility. It's more frequently a problem in men than it is in women. Women are not infertile, but they tend to take longer times to get pregnant, whereas with men, the major issue is, again, that thick, sticky mucus blocks the ducts that allow the sperm to travel out into the body and cause a pregnancy, and women are plugged up by the thick mucus, and so men who have cystic fibrosis tend to be sterile. I think that this disorder can cause major problems, and it can help the students to understand it if it's explained to them. Use of videos, simulators are excellent ways to achieve this objective. Also, presenting this material that I just did to you in a PowerPoint format might be helpful as well with the presentation and help the students understand it better. A final thought for a presentation might be that have an online discussion about this topic and how it can affect different things, and have articles researched by the students and have an online discussion to solve and understand these issues.